Welcome. In this video, we'll walk through key coding steps for radiology X-ray services, covering CPT codes, imaging views, charts, ICD-10 tips, and common pitfalls to avoid. Let's get started. Let's review the CPT code used to report this service. 73660, Radiologic Examination, toes, minimum of 2 views, used for radiographic evaluation of 1 or more toes when at least 2 views are documented. These radiographic views are used to assess fractures, dislocations, deformities, and sesamoid pathology in the toes. View type determines CPT selection. Grouped by imaging focus, standard evaluation views, AP view, evaluates toes for fractures, dislocations, arthritis, or gout. Oblique view provides enhanced bony detail, particularly for joint spacing and rotated fracture lines. Lateral view, used to assess dorsal or plantar displacement of fractures or dislocations. Specialized view, sesamoid view, tangential projection to assess injury or inflammation of the sesamoid bones near the first MTP joint. Order exam, toes, 2 views, header, AP, lateral, and oblique views of the left toes. History, mass on the middle toe. Comparison, none. Findings, no acute fracture. Deformity of the third digit distal phalanx with dorsal displacement of the tuft. Bridging callus and a small ununited fracture fragment at the distal aspect of the tuft. No lytic lesion identified. Impression, healed fracture of the third toe tuft. No definite soft tissue mass. Recommend MRI or ultrasound if clinical suspicion persists. Let's look at the views, AP, oblique, and lateral. That's a total of 3 views. This qualifies for CPT code 73660, left radiologic examination, toes, minimum of 2 views. Now let's choose the appropriate diagnosis codes based on the clinical history and chart findings. Report findings state: healed, ununited fracture deformity of the third toe, bridging callus and dorsal tuft displacement, no acute injury, no definite mass. The reason for the exam was to evaluate a mass on the toe, but there was no finding to support the mass. The most appropriate ICD-10-CM code is M20.5X2, acquired deformity of left toes. This code is selected based on imaging documentation of a healed deformity of the distal phalanx of the third toe. This is the residual condition being evaluated. Correct codes for this report include 73660, radiologic examination, toes, minimum of 2 views, M20.5X2, acquired deformity of left toes. Thanks for watching. Be sure to check the links in the description for helpful resources. And subscribe for more radiology coding content. CPT is a registered trademark of the American Medical Association, AMA. CPT codes are used in this video for educational purposes only and do not reproduce CPT descriptors in full. This video is not a substitute for the AMA CPT Professional Edition or official coding guidelines. Verify all codes with the most current CPT code set and payer policies before claim submission.